My name is Teacher Idza. I go by Rose. So, my topic is sleep health. I will start by just the definition of sleep health, the definition and significance. So, sleep health is it involves the right amount and duration and quality of sleep. Poor sleep impacts our physical health. It leads to obesity, diabetes, mental health, anxiety, depression, and safety issues. People have accidents because they didn't sleep well. And the Health People 2030 goal is to increase the percentage of adults who get good sleep, and is to raise public awareness in the sleep diagnosis and sleep disorders. And then the next thing I'm going to talk about is the practical implications, which means our role as providers in sleep health or sleep disorders. So, as providers, we should be able to screen patients for sleep duration, routine, and visits. Kind of ask them, hey, how do you sleep? When do you sleep? What is your sleep routine? And encourage the non-pharmacological treatments, sleep hygiene and education, a reduction of screen time and reduction of caffeine, especially towards the evening, reduction of fluids for those people who frequently go to the bathroom. We also need to have clinical recommendations for sleep questions to be asked when a person is visiting, and we also need to refer to the appropriate policies when we are talking of sleep and educating people on sleep. So there are policies and programs that have put in place by different organizations. So we do have the US initiatives addressing sleep health. So the CDC sleep health campaigns. This is education regarding sleep for every age, for the young people up to the older age. And the Health People 2030, the public health objective for Health People 2030 is to promote good sleep behaviors, and they are starting in schools. So they want to have a legislation that goes into the schools, that will delay school time for the benefit of the young people. So there should be a time where school starts, which allows the children to be able to sleep on time. And so the impact on population, so the impact on the general population, according to the Jackson L and the CDC 2020, it's over 30% of the US adults get less than 7 hours of sleep per night. So poor sleep distributions to workplace injuries, vehicle crashes, and chronic diseases. The vulnerable groups are the minorities and those of low income. They face a lot of barriers, such as shift work, poor sleep environments, poor accommodation, too many people in the house, too many movements, which disrupts their sleep. And the adolescents experiences sometimes they delay the onset of sleep, and also the early school times. That is why there is legislation, people lobbying for legislation for school to start in a certain time. This is just to allow the children to sleep. Then there's also the cultural considerations. So there are other cultural beliefs and practices. So different cultures have different perceptions of sleeping. Some call sleep and some of the sleep duration. And you find there are some cultures where people sleep in together in one room. For example, some parents sleep with their children up to an older age, and that disrupts sleep for both the parents and the children. There's also the issue of stigma and language that may risk the factors. It has also been reported that it causes sleep difficulties. What should be done to address these discrepancies? Public health messages must be culturally and according to the languages. So let's have communication in the appropriate languages. Spanish for those that are heavy Spanish areas, and to increase the disorder sleeping patterns when we have an opportunity to talk to the community. So, in conclusion, improving sleep health is vital to achieve broader health goals. And addressing this issue requires a multi sector collaboration. This includes the education, the healthcare, workplace policies. And we also want to promote to the community level interventions. We can promote equitable access to sleep health resources is essential. We need to reduce health discrepancies, improve population health, improve housing, improve all the things that cause people to have disturbed sleep patterns. In this last slide, this is just the references, and thank you for listening.